For the case study question, I tend to think about this to prepare myself in the sort of way that I would a normal case. For the case study question, although you won't know what exactly will be asked in the interview, I do think that you can prepare for this. And I've put some bullet points together just to help you with thinking about this. I think that'll give you a really good starting point for how you deal with this, because you will be under pressure when you're answering, but you can definitely go in with a structured mindset around how you might address it. The first thing is, I would advise that when you're reading it, don't read it cold, sort of imagine that it is a real situation. As you would normally, when you get a referral, you'd start by collecting the information. So you'd think about whether the person's been in touch with social services before. If they have, there's likely to be some case notes or history of the person, which you'd read prior to going in. Then you'd also look at whether there's other professionals involved and speaking to them or attending any meetings, just to find out a bit more. I'd also be thinking about the person's medical history, and this will be important for your assessment, but also just to make sure you're prepared before you go in. This might give you a chance to show your knowledge. In a case study that I saw, there was someone with fibromyalgia. Because I knew a bit about that, I was able to say that they might be fatigued at certain times. So taking a person-centred approach, I'd speak to the person and find out a good point in the day that might help them to be able to communicate with me best and feel most comfortable. The next thing is, although we need to assume capacity, we also need to have it in our minds about whether the person has any cognitive impairment or issues that might mean that they have difficulty engaging in the assessment process, or any problems with consenting to the assessment. So this is the bit where you'd be thinking about advocacy. Also, if just to consider whether they have had other professionals involved in the past. They might have already got a really good relationship with a wellbeing worker or a matron, and if they have, it might be worth asking the person if they'd like them to attend, because that'd help you and the person with making sure it's as comfortable as possible. The other thing is just looking at if there's any warnings for yourself or others. You might find that there's something on the system that says that there's a reason that there might be some risk to carers. If there is, then you just need to be aware of that before you're going in and planning any support that you might put in place. The next thing is thinking about your assessment skills and knowledge. So you are doing this assessment under the Care Act, so it does need to be person-centred. This means that anything that you are saying needs to be informed by that mindset. In reality, this means that you'd approach it in a very particular way, thinking about the person's perceptions of their own needs and how their mental or physical needs might affect them. Everything needs to be guided by the wellbeing principle. That means finding out what's important to that person in their own life. We're not just focusing on safety above everything else. We also need to think about what does a good day look like for them? Do they want to be more engaged in the community and things like that? So if you are getting a situation where the person's really neglecting themselves, but then you also see on the case study that they're really socially isolated, it's just not going straight in and thinking, if I put in a package of care, it'll address their needs around their physical well-being, but then ignoring their emotional side, because it's important that we're looking at things holistically. You need to think about the person's values and what makes them who they are. That'll help you to establish trust. I would take a strengths-based perspective, considering the resources, networks, interests and skills the person has. You could reference knowledge of models of assessment, such as the exchange model, the questioning model, and also you could think about whether there's any safeguarding risks. This might be something that comes up in the case study, and I know it's come up in all of the ones that I've had so far. And consider whether the person's at any immediate risk and think about how you would manage that. And then remember that we have a duty to safeguard adults under Section 42 of the Care Act, and showing that you know this is always helpful in the interview. Do not make any firm recommendations. The panel will want to know that you won't jump to conclusions without having all the information. So you can make this clear in this part. However, you can make suggestions to show your knowledge. For example, you might want to consider the personal and environmental factors. That might include any adaptations the person already has in place, or considering whether you think that that would help the person. Things like a key safe, so that if there was an emergency and the person had had a fall, say, someone could get in and help them. You'd consider the services already involved, the person's safety in terms of any fire hazards, so have they got vital line or smoke alarms? Is a fire safety referral needed? Think about the eligibility criteria. Remember, people are entitled to an assessment when they've got the appearance of need, even if you don't think they'd meet the criteria. Community resources, about ones that are specific for the person. For example, befriending services if they're lonely and things like this. It depends what comes up in the study. Find out about finances. So that includes the charging process. Think about whether they have savings above or below the capital limit. Always think about ways to maximise the person's finances. For example, are they getting the right amount of benefits? Are they in any debt? Do they need to get any support from the Citizens Advice Bureau or any benefits that they might be entitled to? If you do know these services that are around in the area you're applying for, this can be helpful. Thinking about referrals to other agencies, thinking about whether there's any pets or property considerations you might need to make, because we do have a duty to safeguard pets and property, and thinking about medication as well. Is the person able to manage this themselves, or is there any considerations you might need to make? For example, blister packs and things like that, and maybe they need the carers to assist with that.